Well, the issue of mental illness and mental health are front and center tonight, with experts talking about how to change the system. It all comes on the heels of that new report on Sandy Hook shooter Adam Lanza. As we told you back on Friday, his mental illness went largely untreated and ignored. Medical reporter Jocelyn Memento live tonight in News 8 Control with more on a roundtable held today with experts. Jocelyn?
And on the heels of the Adam Lanza report, Senator Chris Murphy led his fourth roundtable in the state with mental health experts serving up ideas to overhaul the mental health system at the federal level.
The report of the Office of the Child Advocate on Sandy Hook shooter Adam Lanza set an even more urgent tone at this latest roundtable discussion, hosted by Senator Chris Murphy, with Senator Richard Blumenthal alongside.
It is a fairly damning assessment of the way in which we administer care to vulnerable kids.
If I had to pick the overriding message of this report, intervene, screen, get the family engaged at the earliest possible stage.
New evidence and reason to pursue the fight to restructuring and reforming mental health in the next legislative session.
This is the biggest barrier for integration.
They heard from mental health professionals, providers, and advocacy groups from the New Haven area on how to do just that. A common theme, connecting the fragmented resources contributing to the disconnect when it comes to treating mental health issues and implementing coordinated care.
I think what we need is some way to better incentivize coordination between many different groups, insurance providers, hospitals, outpatient clinics, to do what I think we all think is the sensible thing to do.
Corinne Taylor is a mental health survivor.
When I look back at my journey, I see the trauma and people could heal.
She wants more funding for peer support groups aimed at overcoming the stigma of mental health.
It shows that peer support works because it's people with lived experience. I mean, AA and NA, they've been doing this for years, supporting each other anonymously and not stigmatizing each other.
Both senators stressed there is bipartisan support to overhaul the current system, that now is the time to get it done for the benefit of all.
Many agree that programs already exist to provide a more patient-centered care, but funding is needed to address the lack of coordinated treatment of care. Ann?